Too many people don't retire early because they're worried about healthcare costs. It's another cost. You have to plan for it. I'm going to show you how to do it today. And I don't want you to just not retire early only because of this cost. Why? Well, I have clients that spend $50 a month. I have other clients that spend $1,500 a month. And sometimes this client's even happier. You're like, why? Well, they might be doing a strategy that's saving them more money than just that $1,450 difference. So the point here is I'm going to show you a real case study that I work on with clients so you can see, okay, what might it be for me if I were to retire early, not have my traditional healthcare that I've always had through my employer? What's that going to cost me? How does that impact my plan? If you're looking for more of a high level overview of, hey, what different policies exist? Should I go to a marketplace? What about Cobra? I invite you to check out this episode here with the health insurance expert we work with. You can see here a significant amount of people going, I need to get health insurance. I just don't know how. I recommend this episode. If you want to see the core numbers and a real case study of, got it, how much is this going to cost me? What would it be like? Then I recommend sticking right here because I'm going to show you. Now, this case study I'm showing you right now, this is the same case study I just did a Roth conversion example on, because a lot of you are always wondering, hey, healthcare subsidies, Roth conversions, my whole plan, how does all this connect? So if you want to see this same couple example that I go through just with a Roth conversion example, you can check that episode out as well. Healthcare costs can vary wildly. Look what this person said right here. My coworker retired at 62 10 years ago, paid $1,600 a month for her and her husband's health insurance until they reached 65, cost them $60K. The healthcare team that we utilize here is Move Health, and you can see they say each scenario is highly unique and depend on so many variables. We've seen folks retire with premiums that are high, just like $1,600 a month, and others that strategized and paid nearly zero for health insurance. Now, we're going to hop right in. I'm going to show you this couple because it's one thing for me to show you healthcare and what's going to cost, which I'm going to show you in just a second. It's another thing for you to actually go, okay, how does that impact my plan? So here's the couple that I'm discussing this with. I'm going to show you the core numbers and bring it all back. So this couple is 55 and 52. They have a child who's 16 and they're going, look, how much is healthcare going to cost? We don't know how long we're going to live and how long we want to work, but we don't hate our jobs, but we'd like to be done at some point. At first they thought when they were working with me, maybe it's 60, then they thought 55, then they thought 58. So right now they're thinking about 58, but they're wondering if they were to stop working at 58, how much is it going to cost from 58 to 65 in healthcare? So I'm going to show you an example right now. This is the estimator tool that we'll use for healthcare. If you want the same access to this, you can look in the description and get this as well. Now, this is the couple. This is the zip code that they're in. So they're in Oregon, and I'm just putting their name as sample just here. But this is all I did. I went in here, I put in their age, 55, 52, 2 people in their household, $25,000 as their income. This is the important variable here. So all this is me saying is if they were to retire tomorrow, which I don't recommend for them, but I just showed this to them as a hypothetical, just as you should do right now. If they needed to pay for healthcare and they had $25,000 of income, they wouldn't be paying anything. It would be $0. And some of you are like, is that legit? What if it was $50,000 that we were bringing in as a couple? Well, if you had a silver plan, it would be $135 a month, meaning you're receiving a federal subsidy, premium tax credits of $1,400 a month. So a lot of people don't understand you can keep your income really low and be strategic here. So this is one thing. Now, here's the important thing to note. Let's assume all your money's in an IRA and you're 60. Let's just use that example. Well, if you're 60 and all your money's in an IRA and you want to live off $100,000 a year, and it's once again all in an IRA, well, you have $100,000 coming in. So if you have $100,000 coming in, that's taxable income. So now all of a sudden, look what happens here. Well, now you're spending $684 a month on healthcare. You're receiving a benefit of $880 a month, but this is for 2 people. I mean, this is still, many of you are like, yeah, I mean, how's that going to impact my plan? Well, I'm going to show you in a second. But the point here is you get to be strategic. So one of the things I talk a lot about is called a superhero account. That's known as a brokerage account or a taxable account or a joint account. That's an account that's not a retirement account like a Roth IRA or a traditional IRA or a 401k. It's outside of that. Now, there's no special tax benefits, meaning when you put money in and it grows, you don't get a deduction for it at first, and then it's not tax deferred, none of that. But you can take that money out and you can pay capital gains taxes, which is a lot more preferential. So what does that mean? Let's assume you have $100,000 and $90,000 you put in and it grew by $10,000. Well, you have a $10,000 gain there. You have to pay taxes on that. That's income. But the $90,000, that's your own money. So you might be able to go, I'm going to live off $100,000 this year, but $90,000, that's coming from my own money. It's after taxes. You've already paid taxes on it. The other $10,000 of income, well, you might, because you have a strategic plan and a brokerage account, you might be able to pay very little, and too many people don't understand these options. Now, some people go, this is so awesome, but the healthcare benefits aren't what they think because now their income's so low, they're actually in Medicaid, which is a mistake a lot of people make as well. So it can be really tricky. But the point here is, let's assume generally for most people, they come to me. They're like, look, I'm going to retire early, probably 58, 59, 60, somewhere in that range. And I'm going to have $75,000 or $100,000. I'm going to have some income because I've got a pension or rental income or dividends or interest, stuff like that. Well, this couple would be looking at $434 a month. That's significant, but it's not the reason to not retire early. And so when I'm doing projections for people, that's $5,200 a year. So let's go to their plan. Now, when we go to their plan, and you can see it right here, when we projected healthcare expenses, we projected $6,000 a year each for them. Well, that's not realistic. Realistically, it's going to be $2,500 a year each for this couple if they were to retire early. Now, right now, let's reset this just so you guys can get a total apples to apples comparison here. If right now they've got about $1 million, they're on track for $4.5 million if they were to stop working at 58. And if they retire earlier and spend more, of course it gets changed. But just on the healthcare component, we switch it from $2,500, to $2,500 from $6,000 each. Watch what happens to the plan. Well, now all of a sudden, it's a big difference. It's a $1.5 million decision. So what we have to ask ourselves is this something that is going to be there every year? Well, probably not, because there might be a year where there's way more income. And what if we do a Roth conversion, hypothetical? We do a big Roth conversion. Well, now all of a sudden, $180,000 is coming in the door. Well, now we're spending $1,250 for healthcare. We're getting only a $300 benefit. So the point here is you want to be strategic and ask yourself, is this going to put more money in my pocket by doing stuff like this? Or are Roth conversions going to put more money in my pocket? Because if we're strategic about this, it might add a lot more money than the healthcare subsidy. That's what we want to be asking ourselves. But the first thing here is really on, okay, am I on a good path for healthcare? Do I know how much it's going to cost? Like anything, it's an expense you need to account for. But too many people simply go, oh my God, don't know what it's going to cost. Not going to retire early. Don't do that. You're cheating yourself. It's like if you've ever run drills, at least this is how I feel because I'm a soccer player. If you ever run drills and you know when you're next to a teammate or your child has been, and you got to get to the cone, and you know some people stop a little before they get to the cone. They just stop a little early because they want to get back and show that they're in first. Like, don't do that. And I'm not mad at you guys saying you are doing that. But some of you guys are like, look, I just don't think I can retire because my neighbor's retired and they have like way more money than me and like I have less. And so like, I don't know if I can retire. It's like, they might want to spend way more than you. They may actually be in worse shape than you are physically, but they're turning around. So if they have to run from this cone to this cone, they're turning around 80% of the way there because the coach isn't watching. So they just run back and they're like, look, I'm in good shape. But really they're cheating themselves. So I don't want you to cheat yourself. I want you to go, got it. I know what it's going to cost me. Okay. And you can go put it based on your zip code. I did this with another person recently. This was their zip code here. And you can see if you put in a certain zip code, it'll say this looks like a state based on marketplace zip code. Click here to run your estimate through our platform partner, KFF. So now we can do it through here. Same tool, just has different adjustments here. So we can go in here, put in $100,000 a year, no coverage available from our job because we're retiring. We have 2 kids, 2 people in the family. We're 55 and let's just say for this separate, I'm just thinking of my clients. I think they're 56, 55 and 56. Number of children, let's just put 1 child, and they're 16. Huge tobacco. I'm just kidding. Hopefully no one's using tobacco at 16. So you can see here when we run the projections, what they're on track for is they're estimated to receive help of about $1,300 a month. So $15,000 a year in a premium tax credit. It covers 65% of their monthly costs. They're still paying $700 a month. That's significant, but it's not the reason to not retire. Now, if their income's different or they're strategic here and they go, you know what, only $60,000, we're able to generate that because of our current planning projections, click submit here. So now all we did was shift it to $60,000 a year. Well, now all of a sudden they're getting $1,700 a month and they're paying $300 a month. So their essentially healthcare costs got cut more than half. And all we did was shift their income from $100,000 to $60,000 a year. So you can see a lot of different moving pieces. If you want access to this, in addition to all of the software tools I'm showing today in this video and most of my videos, you can check that out in the Academy and you can get that right now. Now, if you're like, no, I want holistic guidance from you and your team on an ongoing basis, that's why we do this. I invite you to not just subscribe to the YouTube channel, which hopefully you do find helpful, but also to work with us. Like, that's what we really love doing. And right now I know we have a little bit of a wait list, but I encourage you, if you want to get on that, we are excited to talk to you when time allows for it. We just don't want to bring on too many people too quickly and everyone gets average service. So what we love doing is helping people optimize. And if this is what you're looking for, we look forward to helping.